Well, today we're going to be thinking about thermoregulation. Heat regulation. Thermo just means heat. And this is an aspect of homeostasis. Homeo meaning the same. The conditions in the body need to be kept at the same level. So when we're thinking about temperature, we want to avoid hyperthermia. We don't want the temperature to be too high. And we want to avoid hypothermia. We don't want the temperature to be too low. And we would normally say hypothermia is anything below 35 degrees centigrade. Now, where hyperthermia starts is a bit more difficult to say, because if you go jogging and you're using quite a lot of energy and exercising, your muscles will be metabolizing, you'll be producing heat, and your temperature could easily go up to 38, 39 degrees centigrade. But I would be getting a bit concerned if it went beyond 40 degrees centigrade. So I think anything above 40 degrees centigrade we could count as a hyperthermia, and we'd certainly want to take measures to get the body temperature back down again. Now, why is it so important that the temperature is kept at a constant level? Well, inside every cell of your body there are enzymes, and these enzymes catalyze all of the biochemical reactions going on inside the cells of your body. They coordinate all of your physiology. And enzymes are complex protein shapes, and they catalyze these reactions by virtue of their shape. So if the temperature increases or decreases, that can change the shape of these enzymes, and they will no longer facilitate your biochemical reactions. And of course, life is based on these biochemical reactions. So too cold and we won't get effective physiology, too hot and we won't get effective physiology. There needs to be homeostatic thermoregulation. Now, having said that, if you damage some tissues in your body, like if you have an accident, or if you have a viral infection, or a bacterial infection, then you can develop something called a pyrexia. Now, a pyrexia is a fever. The body temperature goes up because when the body temperature goes up, that improves the function of your immune system and helps healing processes. So sometimes in illness or after trauma, there's a pyrexia and the temperature goes up. And this is why it is so important for us in healthcare to understand body temperature, because we need to observe it, we need to monitor it, and if it goes up or down, we have to interpret that in the context of the patient's condition, because that is giving us vital observational, diagnostic, trend-based studies and observations of how our patients are doing. Now, I don't know if you're anything like me, on a cold day you can get very cold feet. I can get really cold feet sometimes, and on a cold day I'll get cold hands as well. So the temperature in the periphery of the body can often be less than the temperature nearer the centre of the body. And the temperature in the core of the body, in the organs, that's going to be higher still. So it's useful to differentiate between core temperature and peripheral temperature. And when we're taking the temperature of our patients in the clinical situation, we want to get as near core temperature as we can. Now, the core temperature can vary somewhat. Mine's normally about 36.5 degrees centigrade. 36.9 is often considered to be a normal temperature. So body core temperature around about 37 degrees centigrade. Now, having said that, it tends to drop down a little bit when you're asleep. In the mornings it can gradually pick up, and it tends to be highest in the early evenings. But it might not vary by more than 0.5 to 1 degree centigrade. And if you're female, during the second half of your menstrual cycle, the temperature can often be 0.5 degree higher than it would be in the first 2 weeks of the menstrual cycle. So why is it that the body's warm? Well, of course, if it's a warm day, we can gain heat from the environment, from the sunshine, for example, or from a warm breeze. And we also gain some heat from warm drinks or warm food. But the main reason that the body is warm is that it is metabolizing. It is producing energy. It's breaking down energy-containing molecules, using the energy for physiological processes, and generating heat as a byproduct of those metabolic, catabolic breaking down processes. So catabolism is the form of metabolism breaking down large molecules into smaller molecules, and as it does so, heat is produced. So obviously from the skeletal muscles we're going to produce quite a lot of heat, but also the brain is a metabolically active organ, as is the heart, as is the liver, as are the kidneys. So all of these structures are going to be generating heat. So heat is going to be gained. And also from the environment by radiation, by conduction from warm objects, and by convection as warm air can blow over us. So heat can be gained, keeping the body warm. But heat can also be lost as well. So we can lose heat through conduction, again, direct contact with cold objects, particularly water. People can become hypothermic very quickly if they fall into cold water because the heat is conducted away. But also we can lose heat through convection, through currents, warm air leaving us. And of course, all warm objects are radiating heat. So at the moment I am radiating out some heat. I'm losing heat through radiation. That's why when people are cold, we often use these space blankets, these shiny blankets. And the idea is that that reflects the radiation back in, a little bit like the lining of a thermos flask. Now, how does the body detect what the temperature is within the body? How does the body know this? Well, there are actually two groups of temperature receptors. There are deep temperature receptors and there are superficial temperature receptors. Now, the deep temperature receptors are in places like the abdominal vena cava, the esophagus and the stomach, and they can actually detect the temperature of the blood in the core of the body. But the main temperature detectors are peripheral, and they are in the dermis of the skin. So there are dermal thermoreceptors. And these are just free nerve endings in the dermis, and there are different nerve endings for heat, and there are different nerve endings for cold. So when the body temperature drops, the cold receptors will start telling us that we're cold, and when we are too hot, the hot temperature receptors in the dermis will start firing. They will increase their depolarization rate and tell us that we are getting too hot. So hot and cold temperature receptors are different. But where do these temperature receptors report to? What is the key thermoregulatory part of the body? Well, this is the hypothalamus. There is an anterior, near the front, nuclei in the hypothalamus, which is sensitive to temperature. It is the hypothalamus that primarily controls body temperature. So it registers what the body temperature is, and it then controls the body temperature. So we've got input going into the hypothalamus, mostly from the peripheral, but also to the central, from the central thermoreceptors, telling us how high or low the body temperature is. And it's the hypothalamus that can control that. So first of all, let's think about what happens when the body gets too hot. So if the body's too hot, that's detected by the hypothalamus. It's necessary to cool the body down. So first of all, if you're too hot, well, if you start to warm up, the first thing that will happen is you'll get peripheral vasodilation. So when we think about the capillaries, we have an arteriole here going into a network of potentially millions of capillaries, or many, many capillaries, millions of capillaries if we take several arterioles, draining in a venule. And at the start of the capillary, there's a ring of muscle here, the pre-capillary sphincter. Now, if this pre-capillary sphincter relaxes, that will mean that the arteriole will dilate and much more warm blood will go into the capillaries. And we know this from our own experience, because when you're hot, you go red, don't you? You look flushed. And that's because these capillaries are dilating. Capillaries are getting much wider because the pre-capillary sphincters have dilated, and you get lots of warm blood near the surface of the body. So if this is the surface of the body here, this heat will radiate out from the warm blood in the capillaries out into the environment. And that is the first physiological adaptation that will happen. Now, before this, there might have been behavioural changes. So when you're too hot, you can take off some clothes, you can sit in the shade. So there's behavioural changes first, but this is the first physiological change, the vasodilation. And that means that the blood returning to the core of the body is going to be cooler. The blood is going to be cooled by this peripheral vasodilation. Now, if that doesn't work, there's an additional mechanism that will kick in. So if we imagine that that's the surface of the skin, and you probably know that the skin is in two layers, the dermis and the epidermis. So the epidermis on top, this is the dermis below. Here we have a straight tube going down through the epidermis into the dermis, and this coils at the end like this. It's a coiled tube like that, and it's got quite a good blood supply. So there's blood vessels, capillaries perfusing this, and this is a sweat gland. This is the sweat gland, and this is the sweat gland duct. Now, what the sweat gland will do is it will take some water and indeed some sodium out of the blood and incorporate that into sweat. And sweat will be formed in this sweat gland here. That sweat will start to rise up the duct, and the sweat will be deposited on the surface of the body. Now, you could say that the body's not too keen on doing this because it means it has to lose water. But it's prepared to do that in order to keep the body temperature down. The body temperature must not go too high. Now, once the sweat is on the surface of the body, the sweat will evaporate into the environment. Now, if the environment is dry, if there's a low humidity, this can happen quite quickly and effectively. If the environment is humid, this won't happen as effectively, and as a result you'll feel hotter because your cooling mechanisms will not be working as well. And the reason this works is as the sweat evaporates, the water changes from a liquid to a vapour. And to do that uses quite a lot of energy. And this energy is taken from the body as heat energy. The energy that it takes the water to evaporate, going from the liquid to the vapour state, is called the latent heat of vaporization. And that is a high figure. a lot of heat will be extracted from the surface of the body to evaporate a relatively small amount of sweat. The problem is, if this goes on for long and the patient doesn't have access to a drink, then they're going to become low in body fluids. But you can lose several litres of sweat and still maintain perfectly normal blood pressures, quite a few litres of sweat. So, but as long as you can drink and as long as you can keep sweating, it's possible to maintain thermoregulation even in quite hot environments. Now the problem comes if people can't sweat. For example, if they're wearing a lot of clothes and they can't sweat, then the body temperature can start to build up. Or if they've sweated 5, 6, 7, 8, 9, 10 litres already, and the volume of water in the body is so low, it starts to lower the plasma volume, causing a hypovolemia, then they won't be able to sweat either, and that's when the body temperature can start rising to very dangerous levels. So if it's a hot day, if you're exercising, it's important not to wear too many clothes to allow the sweat to evaporate. And from time to time we have tragic incidences. There was one recently during military training where soldiers were pushing themselves hard on a hot day, heavy packs, walking uphill, wearing full combats. They were sweating, but the sweat couldn't evaporate. The body temperature built up. They developed hyperthermia, and tragically that has fatal consequences. So sweating can maintain thermoregulation as long as the sweat can evaporate. And we notice that the body does this in the most efficient way possible. First of all, it simply vasodilates. If that's not sufficient, then sweating will kick in as a secondary mechanism. So that is if the body is too hot. These mechanisms will get the body temperature down. Now, what about if the body becomes too cold? What will the hypothalamus do then? So it's a cold day, the body temperature is probably starting to drop now. What's going to happen? Well, again, first of all, there's going to be behavioural change. You're going to put on clothes, you might do some extra exercise, you might go inside where it's warm. But given that you can't carry out enough behavioural changes, we're going to depend on physiological changes. Now, when it's too cold, do you want lots of warm blood going to the surface of the body to lose its heat to the environment? Well, obviously not. So the first thing that happens is we get peripheral vasoconstriction. What happens here is we have the capillaries. Well, that's the arteriole there. We have the capillaries as before. We have the venule as before. The precapillary sphincter here, in a cold day, will contract down. It will constrict, making the blood vessel much thinner. That means that much less blood will get through to the surface capillaries because we're too cold. And again, this is exactly what you see. On a cold day, someone will look pale because less blood is going to the surface of the body, therefore less heat is going to be lost. And this is why we shouldn't drink alcohol when it's cold, because alcohol is going to be a peripheral vasodilator. The alcohol will allow the blood vessels to dilate. The warm blood will go near the surface of the body, and all that precious heat will be lost to the environment. Now, if the vasoconstriction doesn't preserve enough heat, then the tone in the muscles is going to increase. There's going to be increased muscle tone. You might not notice that, but as the tone in the muscles increases, the muscles will use more energy, and that will generate more heat. But of course, if that doesn't work, what do we do next? Well, we start shivering. So shivering is the next thing. Now, shivering is rapid, involuntary movement of the skeletal muscles. And that's going to use up energy, generating heat. And when someone's shivering, they can be generating 3 times more heat than they would normally be generating from their metabolic processes. So shivering can keep you warm for quite a period of time. So behaviours, vasodilation, shivering. And over time, we can get non-shivering, what's called non-shivering thermogenesis. Non-shivering thermogenesis. So if you're cold for a period of time, for example, the body will produce more thyroid hormone. And thyroid hormone will increase metabolic rate. So people that are cold adapted, their metabolism is faster if they've been exposed to the cold for a period of time. And even without shivering, they'll produce more heat. And of course, there's one other classic thing that happens when you're cold. Imagine this is the surface of the skin here. And we have hairs here in hair follicles. And connected to the hair follicles, there are muscles called hair erector muscles. Little muscles attached to the hair. And I think you can see if that muscle contracts, that's going to pull the hair up that way and make the hair stand on end. This is called Pilo Erection. The hairs will stand on end. And the idea here is that if all your hairs are standing on end, it's going to cause some air to be trapped here, and that trapped air will insulate the heat. And this gives us the appearance, we call it goose pimples. When someone's cold, they look all sort of pimply, like goose flesh. Very effective in hairy animals, not so effective in humans, unless of course you're particularly hairy. So when we're too cold, these adaptations will take place to generate heat and to conserve body heat. Now, I think the last thing I'll tell you about is what happens during a fever, during a pyrexia. We'll maybe make a bit of space and draw a graph. Now, if body tissues are damaged, or if you get a bacterial or viral infection, then your body temperature will go up. That is a fever or a pyrexia. So we can start off at perfectly normal body temperature there, let's say 37 degrees centigrade. That's fine. But why is your body temperature normal? Why is the body temperature normal? Well, the body temperature is normal because the hypothalamus is kicking in these cooling and warming mechanisms all the time. It's constantly making you peripherally vasoconstrict or peripherally vasodilate in order to maintain homeostatic thermoregulation. And the hypothalamus does this because it has a set point. So at the moment, the set point of your hypothalamus is probably 37 degrees centigrade. It's the set point. And by constantly warming, constantly cooling, the temperature is maintained at that 37 degree set point. So that's normal. Now, if you have a fever, if you have a bacterial infection or a viral infection, for example, the immune system will actually work much better at pyrexial temperatures. So the immune system is working better at 38 degrees centigrade than it is at 37 degrees centigrade. It'll be working even better at 39 degrees centigrade. So if you have a bacterial infection, components from the bacteria can be released into the blood and detected in the hypothalamus. These are called pyrogens. A pyrogen, pyros is fire. A pyrogen will generate a high temperature. And also when there's bacteria, or indeed viruses in the blood, the white cells will release cytokines. These chemical messengers, they will go to the hypothalamus. In the hypothalamus, they will stimulate mechanisms involving prostaglandins, and that will increase the set point. So at the moment your set point is 37, but if you have a fever, that set point will go up. The hypothalamus will say, we've got an infection, we need to increase the body temperature to get rid of the infection. So the hypothalamus will increase its set point. So that black line there is the set point of the hypothalamus. But here we notice that the body temperature, is it higher or lower than the set point now? Well, of course, the temperature now is way lower than the set point. So the hypothalamus will instigate warming mechanisms to bring the temperature up. But when the temperature is coming up, when the body temperature is lower than the set point, as far as the hypothalamus is concerned, you're too cold. So it makes you feel cold in order to warm up. So here you might be feeling cold, you might be putting on covers, you'll be shivering probably, but that will be raising your body temperature back up to pretty well where the set point of the hypothalamus is. So during this time here, from here to here, that time there, the body temperature is actually lower than the set point of the hypothalamus. So the hypothalamus is seeking to increase body temperature. And during that time, the patient will feel cold. They will peripherally vasoconstrict, and they may be shaky. And we call this a rigor. So a rigor is this feeling cold, peripherally vasoconstricted, shaky condition where the patient's temperature, the body temperature is rising towards the set point of the hypothalamus. And once the temperature is up to where the hypothalamus wants it to be, then the patient won't feel hot or cold. So here, even though the body temperature is say 38, the patient can feel cold. In themselves they will feel cold because the body temperature is going up. But here, even though the body temperature might be 39, the patient might not report that they feel hot because their body is where their hypothalamus wants them to be. So, after the temperature is after the infection is abated, the hypothalamus can reduce the set point again, back down to normal. And the temperature of the body will follow this. So what we might find here is that we're in a situation now where the body temperature is higher than the set point of the hypothalamus. So the hypothalamus will induce cooling mechanisms and the body temperature will start going back down to normal. And if anything, during this period of time, the patient's going to feel hot because the set point is lower than the actual body temperature. And this works quite dramatically if patients take antipyretic drugs such as ibuprofen or paracetamol. If we give the patient a drug to lower their body temperature, that interferes with these prostaglandin mechanisms I was talking about in the hypothalamus, drops the temperature, then the patient ends up feeling very hot and they'll start throwing clothes off to cool down because they'll feel hot. But of course, if we do that, when the body temperature goes down, that will reduce the efficiency of the immune system. So in adults, it's best to leave the pyrexias as far as we can, knowing that that increases the efficiency of the immune system. And this point here where the temperature just starts to drop is sometimes called the crisis point. And before antibiotics were available, the family would gather around the bed waiting for this point, because they knew that when people had fevers, they could either live or die if there was no antibiotics available. And once the temperature started to go down, the patient was described as being past the crisis. So remember, if a patient says they're feeling cold, that's probably because their body temperature is going up. They could be developing a rigor. So the body temperature tries to follow the set point set by the hypothalamus. So the hypothalamus is the key to this. The hypothalamus is controlling thermoregulation normally using homeostatic mechanisms. And the hypothalamus is altering its set point to promote healing and to help the body combat infections during pyrexias or fevers.